Hi, this is my video for straight catheter male. So I'm going to check the order for the catheter. Also check that there is no allergies to latex or iodine in the patient's chart, and also I can ask them to verify. I'm going to come in the patient's room, do my hand hygiene, close the curtain for privacy. Hi, Mr. Jones. I'm Samantha. I will be your student nurse, and we are going to put in a straight catheter to empty your bladder. So I'm going to raise up the bed to a good working height. Put on clean gloves. And over here I have my basin with my washcloths and warm water and stuff ready to go. Firstly, I'm going to pull down the blanket and look at his abdomen. And for the straight catheter, I am just going to inspect the abdomen, make sure it's not distended, rotund, check the umbilicus, and then I'm going to palpate for any tenderness and also palpate the bladder, which it is distended, so that does confirm that we need the catheter. So then I'm going to roll down the blankets and take out one of my washcloths that was in my warm soapy water. I am going to clean around like that, switch sides, clean around again. I would put this in the dirty linen, grab another one, and dry. That one I would have used 3 times. Clean 3 times, dry 3 times. So we're gonna dry around, switch sides, dry again, and then turn the washcloth around and dry once more. And this would also go in the dirty linen, which I'm going to need later, so I'll put there. I'm going to pull the gown down as much as possible. Leaving this blanket down, but covering up for privacy while we get our supplies ready. So I'm going to take off my clean gloves and dispose of them in the trash. Grab my supplies. Open my package. And then I'm going to use this for my trash receptacle. I'm going to open this. Take out this and slide it underneath him. This one we don't need, so I'm just going to discard of that. I'm going to take my disposable gloves, come over here and put them on. And I would actually not have my rings on. And Okay, well, we're going to, I'm in a brain fart. Okay, we're going to grab it and keep it above our waist. Slide that one on. Come over and grab this one. Keep it up and slide that one on. And we're just going to get rid of that so it's not in our way. Take this and we are going to separate it. Pull that off. I'm going to take my specimen cup and label, set them aside. I would take my iodine at this point, my iodine sticks, and open them and have them up here ready to go. And as well as my lubrication, I would generously lubricate the end of this, pouring some here as well, and then setting the tip right in the lubrication so it's all ready to go. I'm going to reassemble this and then move my sterile field over to my patient. So this would already be open, and I'd pick it up and take out an iodine stick. Grab, hold firmly, and clean around the tip going towards the back. I would throw that away, grab another stick, and continue to clean around using as many sticks in the package. And I would discard of this. So next I am going to insert the straight catheter. At this point, I would probably have an assistant with me to do the clean catch urine specimen. So I'm going to take the end of the catheter that is lubricated, hold the penis with my other hand firmly, and insert about 5 inches until I get urine return, which is about right there. So I'm going to hold it while the urine's flowing there, and like I said, at this point my assistant would come over with the cup and catch a sample midstream into the specimen cup. Once there was no more coming out the end, I would pull back a little to make sure that the urine is indeed done flowing, and it is. So then at this point I'm going to pull the catheter out, slow and gently, lightly set that in there. And I'm going to leave that there for a second while I clean the iodine off my patient. So I'm going to come back to my basin of soapy warm water, grab a washcloth, fold it up. Fold it up and clean all the iodine off, working in a circle from tip to the base. Turn it around and do the same thing once again. And turn the whole washcloth around and clean one more time. Getting all the iodine off. Then I would dispose of that in the dirty linen, take a dry washcloth and dry him. Same thing, folding it around my hand and going around 3 times or until he's completely dry. Dispose of that in the dirty linen, and once he's completely dry, I'm going to remove all this. Hopefully not doing that. And then we would take the catheter out of here, dispose of that, and then we want to take this into the bathroom, pour it into a graduated cylinder to measure it, and then when we're done doing that, we're going to dispose of it in the toilet. We're also going to measure what is in our specimen cup and add that to that because it is part of the total output. And we want to cover our patient up, get them back into a comfortable position, and lower the bed to the lowest position possible. Then we're going to document the whole procedure, what his output was, how he reacted to the catheterization. All of this disposed of, gloves off, hand hygiene, and that is it.